Yes, so we mostly have been doing universities since the start of this. We have talked to hospitals about doing kind of like deliberate practice or rapid cycle deliberate practice with, suicide assessment and things along those lines. Since we are not able to do as much of the psychomotor ability because this is a virtual interaction, it has been mostly universities. And
Thank you, Megan.
All right, great. So the opportunity with this is, again, this is a freeze. You have the ability to do a freeze frame. That's kind of what we call it. Or you have the ability to do an entire clinical group or an entire nurse residency program going through this experience together. So we have done this at University of Fresno or University of California, Fresno, and we utilize this freeze frame technique. So basically what this is you would have that group being able to sign on to Zoom, and then you would have your SP on that call, as well as the clinical instructor or simulation faculty on that call. So you do have the ability for them to kind of go through, and basically you'd have that first learner interact with the SP, do that brief interaction, and then kind of go through the first 5 minutes of the simulation. And then the instructor then can freeze the simulation and do a rapid debriefing session with those students. So then they're kind of able to talk through that situation, where they would like to go next in that simulation opportunity, and then they're able to continue that experience basically. So then the SP will come back, they'll continue that experience for the next 5 minutes, and then again, freeze it again, do a rapid debriefing, go through that experience, and then continue on with that SP. So it's the ability for a group think, again, during those rapid debriefing sessions, they have the ability to really talk to one another and share what they were feeling, share where they'd like to go next, what do they want to get out with the patient and discuss. So they do have the ability to really kind of work together to come up with their solution of where they're going to go in that simulation experience. And we also found that it really reduces the learner's stress in that experience, that when they feel that they have the support of their teammates and that they know that they're going to be going for 5 minutes and they're next, and they kind of have that pointed direction, they feel a lot less stressed, which is that the ability to really increase that learning opportunity, because again, it is in that virtual setting. A lot of our customers, they do not currently have an SP program. So these are some of the first times that their students are interacting with an SP, which again is the opportunity for them to get feedback from the patient's perspective and really engage in that experience. So again, it's a little bit different than that traditional simulation experience, but it is a lot more interactive than the standard avatar experience that they're going through. So I'm going to show you guys some videos just so that you can get a brief idea of what these interactions look like. So I'm going to start with just sort of the first introductory. The simulation I'm going to show you is a motivational interviewing simulation. So basically the SP, well, not the SP, the patient was court ordered to come to a therapy session to discuss their alcohol consumption and alcohol use due to some violations that they had in college. And now they're going to just be discussing with them their motivational interviewing and opportunities for change. So this is kind of going to just be the first interaction with that. Oh, I'm sorry. Here, let's start here.
Hi, my name is Julie. I'm a nursing student. What's your name?
Hey, Jesse. Just before you even get started, like, honestly, I'm not really, you can just do whatever you need to do. I'm kind of just here to get proof of counseling. So, yeah.
Okay, what brings you in here today?
1 second. Oh, wait, what was the question? Sorry.
It's okay. What brings you in here today?
Yeah, like I said, just proof of counseling. People been complaining about me drinking too much or whatever, but it's like not a big deal. So if is there like something I need to like sign or something, and then we can just like be done?
It might be a good idea for us to spend some time talking about the reason you're here today. Would you be willing to do that?
Sure.
So you can see that there is a barrier there. The SP has their phone out, they're distracted, they don't really necessarily want to be in that interaction. So rather than just the nurses having to think about what they would do and what they would say, they're now in this moment interacting with a live person, and they have to think through what their next steps are going to be. So that's a complete interaction there. And then after this point, they would start their debriefing, their rapid debriefing with their clinical instructor. So their clinical instructor might ask them, how did you feel in that situation? How did it feel when the patient had their phone out? Did you feel comfortable asking them to put their phone away? Things along those lines. And there, they're going to go back into their large session where they have their other cohort in the group with them. And then they can discuss what would be the next steps. What do they think they would want to ask the patient next? Where are they trying to go next in that conversation experience, in the conversation? So again, being able to decide together, and then the next student would start their presentation. So I'm going to play this next section, and this is the area where basically in this debriefing session, they agreed that the phone needs to go away because it's a distraction. So now it's on that next learner to decide how she's going to approach this situation with the patient and what the next steps are going to be.
Hi, my name is Julie. I'm a nursing.
Sorry about that. Here we go.
So I just want to, going off of what Julie was talking to you about your drinking and blacking out, do you know how much you drink usually every time you go out and party?
I guess it really depends. Maybe if I'm doing shots, maybe like 7 shots, some beer,
Mm-hmm. I'd really appreciate it if you put your phone down. I think this conversation would be much more effective for you if I had your full attention. Can you do that for me?
Sure.
Thank you. I appreciate it.
So there you can see that she's approaching the topic. She's, again, comfortable enough to share that. And she's also doing that assessment of finding out how much he's drinking. So again, it gives the opportunity that she can ask those questions, even though he was still very vague with his answers. When they go back to the large group, they might have a participant that says, well, I would really want to nail in, how much they're actually drinking. So it gives the opportunity for the next student to ask more follow-up questions to really nail down that assessment piece. So again, the exciting part with this is we don't do the debriefing at the end of the simulation where there can be some regrets of, oh, I wish I would have said this, or I wish I would have been able to do this. I wish I could have done that. But they're able to talk about that during those rapid cycle debriefing. And then the next person can lead off and go into that next section of the simulation, having that in mind of where they want to go next. And they're able to get that immediate feedback from that clinical instructor of what's needed to be said or where they want to be going in the conversation. So I'm going to move on to the next section. What they talked about now was that they wanted to be able to discuss family and maybe family history and dive a little bit deeper into that so they can get a full assessment of this patient. So I'm going to start this next video, and that's going to share a little bit about that.
Can you tell me a little bit about your family history? Do you have any family history of substance abuse?
Yes.
Tell me a little more about that.
But what does this have to do with me?
Well, oftentimes substance abuse issues can be hereditary. So someone could be more likely to have a problem with alcohol if one of their parents or family members have had a struggle similar.
I really don't think I have a problem though. So is this really important?
Well, I'm not saying that you have a problem, but you're here for a reason, and we just want to make sure that you're fully assessed and that we're all on the same page.
Okay. Well, I guess my aunt.
Okay. On your mom's side or your dad's side?
On my mom's side.
Okay. So how old is she?
I don't know, like in her 50s.
And how long has she been struggling with substance abuse or with alcohol?
Well, I guess for a while, but I mean, like I said, I don't really see how this is important because she not only drinks, but, she does drugs, but I'm never gonna end up like that because I don't do drugs. I don't smoke anything. I just drink with my friends when I go party.
So as you can see there, the SP or Jesse, our patient there, threw in some curveballs that they weren't necessarily expecting. So when asked about family history, what does that have to do with me? I don't have a problem. I don't struggle with that. I don't do drugs, things. So in these simulation experiences, since they aren't cookie cutter experiences, they really can be written into the simulations of how you want them to react and how you want them to respond. So if you want the patient to deflect that deflected in the conversation, they have the ability then to ask those questions and to, again, be a little bit more defensive in their answers with that. So think about those options that you have in these simulation experiences. It doesn't have to be a kosher experience where, at the end of it, it all kind of gets wrapped up in a bow. It can be that there's these deflecting questions. It can be that there's some of this written into that simulation experience where maybe the SP can ask these sort of more off the wall questions, and that maybe throw the nurses off a little bit or the med students off a little bit of what they were expecting the patient to respond to that. So there's a lot of opportunities with what we can do in these simulation experiences, depending on your level of learner and, again, your patient population in your area. These can all be customized to what you want that experience to be. So I'm going to backtrack a little bit just because I introduced the videos and I didn't share the flow, and I want to go back and share that with you all because I do think that's important of what these freeze frame flows look like. So again, if you think about the fact that we've already written the simulation experiences, we've already done our dry runs, we've already done all of the prep work ahead of time, and the SP is ready to go with the patient character. The day of the simulation experience, this is how it's going to look for a freeze frame situation, which again is typically cohorts of about 10 in that experience. So oftentimes you're going to have your instructor and they're going to do the pre-brief with the students without the SP. So at that time, the SP will have their video off, they'll be muted, but they're not going to be engaging during that pre-brief experience. So again, we can do handoff report or whatever that looks like for that pre-briefing opportunity. From there, we're going to have the first student and they're going to start that interaction with the SP. So like we saw with that first video, they're going to start the introduction, maybe start their assessment, maybe start with some background questions, but they're going to start that interaction just like they would with a normal simulation experience. At that point, depending on if you want to set a designated time or you just want to wait till the right appropriate time in the simulation experience, the instructor can then freeze it. So again, they can call freeze. In that moment when they freeze it, the SP will turn their camera off and mute themselves again. And then they'll go through that rapid debriefing process. So they have the ability to do a quick debrief and then be able to discuss where they want to go next in the simulation experience. So they might say, if you had more time, what would you ask next? What do you think is important to get to in this experience? Again, with all of the participants, they can share where they would like to go next or maybe ask some questions that they have for the patient. But then at that opportunity, the instructor can select the next student who is going to participate in that freeze frame. So then you're going to have student number 2, and then they're going to basically unfreeze so that at that time, the SP will turn their camera back on. They will, unmute themselves and then continue that interaction experience with wherever they want to go in that simulation. And then that's going to repeat so that all students are able to interact with the patient at some time. Now, again, when we started this, we didn't really necessarily know, if there was going to be enough to discuss with the patient, but it goes so quick. They have so much to talk about. And honestly, every student is so unique in what they observe and what they see that a lot of times they have a very different viewpoint of the questions they want to ask. So even having 10 students in that interaction, even by the end of the simulation, they still have a lot of unique questions or areas that they want to uncover with the patient or areas they want to explore deeper with the patient. So after every student is able to go through that experience of interacting with the patient one-on-one, we then go to the larger debriefing session. So once that area is over and the interaction is complete, then we're going to move on to debriefing. The SP is then able to give feedback to the students. So they're able to share how the patient felt. And again, just kind of give them those specifics of, in this moment, this is how the patient felt, and they're able to hear from each student is able to hear from the patient their feedback. And then it moves into a larger debriefing session with the instructor. So again, the SP is not the only one giving feedback. The instructor is also going to lead that debriefing session at the end to be able to make sure that all of the questions are answered and all of the objectives are met and covered during that debriefing session. So that gives you just a larger idea of this kind of freeze frame modality of being able to have larger groups interacting with the patient. So I'm going to move on next to kind of a one-on-one or a two-on-one simulation experience that you'll see more often in, an NP program or a medical program. So I'm going to skip ahead to get to this next section. Oh, there we go. So again, these are the one-on-one simulation experiences. So we do have the opportunity to do these as telehealth if you want to keep it through and through as a telehealth experience. But we've also had it where, again, you do a little bit of role playing where maybe this is an at-home situation, or again, maybe we're pretending it is a hospital situation and that interaction is live. The only thing that they do struggle with is, again, since it is a Zoom interaction, we can't do psychomotor skills unless they are instructing the SP on what to do psychomotor. But again, since this is live, it's much more of the affective and cognitive domain opposed to the psychomotor domain. So again, they have the ability to talk to them one-on-one. We're able to keep that environmental fidelity very high because, again, if you think of creating the scene and setting it, it's very realistic, and they really are on the spot with those conversations. So again, we've heard from a lot of our students that they feel like it's like the real thing, that they feel like this is truly, they're immersed, and it's just like what they would be seeing in their clinical or in their simulation experience. So this is a little bit different of the flow. So I'm just going to explain this because it is different than the freeze frame flow. There's kind of these two different ideas of what we've primarily been doing throughout this. So again, if you look at having the instructor, they'll still do their debrief with the SP with their video off, and again, rename to the character's name or the patient's name. And then the first student will go through their interaction with the SP. That's going to take predominantly the majority of the time. And then you will have the SP provide feedback to the learner. So again, rather than having it switch between the learners, it's just going to be kind of a through and through, like a traditional simulation experience. The learners will then be able to ask questions of the SP or of the patient of, if I would have said this, or if I could have done this a little bit differently, how would the patient have felt? So they're really able to get a very thorough debriefing session of being able to interact with their patient and get that very direct feedback. And then after they get that feedback from the SP, they can move on to the full debriefing session with the instructor in the room. So again, it's a little bit different. It's a little bit different of objectives, and it really just depends on what your institution is trying to accomplish with being able to do these virtual simulations with live people. So I'm going to move on to some of the videos. This is the same character. Again, this is Jesse Rogers, but this is going to be a one-on-one session. So it's going to be the same student and the same SP throughout the entire thing, and we're not going to be switching back and forth. So it just goes to show a little bit more of the richness that you can get out of it if it is a one-on-one experience.
How are your roommates?
I mean, they're fine. I mean, sometimes we hang out, but sometimes they're annoying.
Okay. What do you mean by annoying?
I mean, sometimes they don't feel like going out, or they'll try to pull me back, but it's just like they don't know how to have a good time. You know what I mean? Like, we're in college. Like, what else? Like, you were in college. Like, what are you supposed to do? Like, it's the weekend. Like, we all want to have fun.
Okay. Well, would you say they annoy you with that attitude?
I mean, yeah, obviously it's annoying if you're trying to have a good time and you have people that are trying to dragging you down.
Okay.
So again, as you can see, they got into a little bit more detail quickly, but it's because this nurse has the ability to kind of go into that area that he wants to focus in on. So again, he's able to really navigate that conversation. Whereas the freeze frame, it's more of that group think or that group activity that they are doing together. So it's a little bit different, but again, they're able to get into some more detail. I'm going to go to the next part of this.
Steps to modify some of your habits a little bit. Maybe drink a little bit less Friday and Saturday. Maybe find some activities that you can do without drinking.
I mean, drinking less. I mean, like I said, like I could definitely like do, I mean, I'm in control. So I mean, drinking less. I mean, I can, but I don't plan to stop drinking, obviously. Like, I'm still in college. Like, I'm not gonna just like ruin my experience, but like if I have to cut down a little bit, like, then like, I mean, whatever.
So the part that I really like about this clip is you have the ability with these live experiences that the patient can react in real time. So depending on what the learner says, again, talking about cutting down, the patient can be very defensive about that situation, especially because right beforehand, he had mentioned, you know, your habits that you've been having, let's cut down on those. So again, since the patient is experiencing that and feeling that, they have the ability to be a little bit more defensive in that situation and react in real time. So again, the nice part of this is that it's not these preset simulations of this is exactly how it's going to go, but there is that element of the patient being able to interact and react to the care that's being provided to them. So again, it's like this is supposed to mimic a real patient interaction, and again, be as realistic as possible because they are able to have that you know, interaction and then react depending on the care that's being provided. So again, I always love that because I think that it's a really realistic situation. And again, you're able to still see that in a virtual setting. This doesn't change that. And it would be the same thing that it would be in simulation. I'm going to move on to the next video. Oh, I guess there's only two. Sorry about that. Okay, so we're going to move on to the character descriptions. So this is part that comes with your simulation. So again, if right now you have a simulation that works really well for your program and you want to convert it to a virtual format, we have the ability to come in and really write a thorough character description. This is something that here at Avkin, we really take pride in and we take a lot of ownership of, is that the patient is not just simply a diagnosis or simply a few sentences to explain who this is, but a patient is a real person and they have things going on in the background. They have stress that's going on with their family. They have questions maybe about their new diagnosis, but there's so much to the complexity of these patients. And oftentimes we're not seeing these in the simulations. Oftentimes the character or the patient is really overlooked and maybe just dwindled down to a few paragraphs. But here at Avkin, we really focus on getting to the nuances of making these patients not just a simple, you know, diagnosis, here's your family, here's your religion, here's your ethnicity, but really diving into what makes this patient unique and what makes this person a realistic situation. So again, we focus on the objectives. We share whatever the objectives are with our SPs because we want to make sure that it's standardized. So again, we want to make sure that every single SP is providing the same level of difficulty when they're going into that simulation experience. So we provide them with the objectives. We go through whatever the injuries or the diagnosis may be, but we spend a lot of time on what their background is and what brought them here to the hospital. Because again, you're not going to get that same level of richness or depth if we just provide some simple paragraphs. So we really spend a lot of time going into the background and getting to the nuance of this character. We then go into the health, family, housing, all of these things that are going to make up this patient very uniquely. Again, then we're going to go into social history and academic. The last piece of this is we have the interaction guidelines. And the interaction guidelines are really what you're going to see in the simulation experience. So it really navigates the SP and it really tells them how they need to portray this patient and to what level of difficulty you want them to portray this patient. So if these are novice learners, obviously we're not going to make this a super complex character that has a lot of walls up and a lot of boundaries. We're going to adjust that and make maybe them a little bit friendlier and a little bit warmer. But if these are practicing physicians or if these are practicing nurses, the level of difficulty is obviously going to change with that character. And we're going to see that in those interaction guidelines. So that's something that here at Avkin, we work very closely with you and your institution to make sure that the SP is going to be standardized throughout the entire experience. So that they're going to provide the same level of difficulty. And that again, they're going to be the right level of difficulty based on your objectives and based on your learners. So we do spend a lot of time working with you. And then you're going to be able to see this character come to life during the dry run. So once we write all of this out and you're able to approve this and see what this is going to look like, you're then able to see it come to life in the dry run with the SP playing this patient. At that point, you're also able to give that feedback on, oh, I want them to dial it up a little bit here. I want them to calm it down a little bit here, whatever that may be. We will then go in and we make those changes to the character and to the simulation experience. So then we're going to go in and make those changes of what needs to happen. And then we're going to come back and do the simulation experiences. So you're going to be approving this the whole way through. You're going to be looking at this the entire way through and making sure that it's appropriate for your level of learner and your experience that you're going to provide. Again, the other huge benefit of being able to invest in the SP virtual solution is the fact that these simulations are going to be yours. So if you want to adjust this to a live simulation after COVID is over, or once you get back to in-person simulations, it's going to be very easy to do so, to modify this to the right, to the in-person simulation experience. So keep that in mind, that again, these rich character descriptions and these rich simulations that you will be provided is that they are going to be yours to keep. And so this isn't just a one-time investment or a short-term investment. This is a long-term investment for you and your program of utilizing live people in simulation. So I just want to talk a little bit about the different people who have been using the virtual SP solution. So Marie Gilbert at California State University, Fresno. So again, they have been able to do 2 different undergrad experiences. They chose the 2 that they needed the most, which was a maternity simulation and then a fundamental simulation. So those were the 2 areas that they really need to have their clinical students go through. And so again, we focused on, the one was a fundamental situation where it was a migrant worker who was not taking his pain or taking his medications after a new diagnosis of congestive heart failure. So we had the SP get ready. He was in a hospital gown and again, kind of went through the discharges with discharge instructions with that SP and able to ask those questions and get feedback from the students. We then did a second simulation that was a new mom who just found out that she was pregnant and she's currently drinking and using drugs. And basically there was some motivational interviewing there of being able to just kind of steer her in a healthy area, that since she is pregnant now and wants to keep the baby, what are the different things that she can do to start cutting back on her alcohol consumption and drug use. So again, with Marie, it's been a pleasure to work with her and her team. It's been great to be able to see how excited the students are with these experiences. They really get so much out of it, and it's so rewarding to just see how much they enjoy these real life interactions with a patient. And again, we have hopes to expand this in the next semester, where we'll be doing evolving cases so that they will see the same patient, but in 2 different settings, and really being able to see the next steps of what that looks like. So again, we're really excited about what those all have been and the positive experiences that we've seen with that. Also from the students. So these are things if you've ever come to an Avkin presentation at some of our workshops, you'll hear us say all the time that we fell into it sideways, because that just seems to happen all the time with us, is as we're learning here in simulation. And I think any simulationist can agree, falling into it sideways or sideways learning is very common for us. But with moving to these moving to these virtual platforms of simulation, we've heard from students over and over again that they really like to hear from their peers and the perspective of their peers. So again, this is something that they really like to be able to see those interactions. And as a simulationist, I think we can all agree that we learn from our students watching these simulations over and over again. And me as an SP, a lot of times I'm in the bed playing the patient, but I think to myself all the time of like, wow, that is such a unique way of coming at this question, or that's such a unique way of doing that assessment. I've never seen that before. Because again, every student is different and they come from their own background. So it's so interesting to see how they approach these situations. But again, being able to talk to them and then now seeing how their peers respond, it really helps them in their own professional growth of being able to say, oh, that's how they approached the topic of suicide. That's how I'm going to approach it the next time, because that was a really great way of how they did that. So there's a lot of peer learning and a lot of that group think, which just really, really adds to that experience that a lot of times we lose in the simulation opportunities that are live. So being able to have that was, again, just a sideways learning that we never really thought of, but that we've seen huge success with and has been very exciting for us. We've also heard that they really like having their clinical instructor there to give them that immediate feedback. We heard a lot that they were saying that a lot during debriefing, that they're not sure exactly those moments in time that they should have been doing something else, or they should have focused on something else, or maybe what they had done that was good, or what they could have worked on. And having this immediate feedback is the ability for them to immediately see how they could improve in their experiences. And again, it's just that opportunity that now they have a real person who is not biased, who's just, again, portraying the patient, and they're able to get that real feedback from the patient's perspective. And again, that's huge. I'm going to just share a video with you of some of the feedback that we got. This was from University of Delaware students. They approved us to be able to show all of this, and we're very grateful for that. But just some of their feedback on what their experiences were as the student being able to interact with a live person during the simulation.
This was really good to have that feedback right away, because that's kind of what helps you build as a nurse. Like, oh, let me fix this problem now, instead of I heard it later. And when you fix it now, you get more of an understanding of everything you need to fix, I guess.
I feel like I learned a lot, because like we've been doing therapeutic communication like worksheets, and I feel like it's one thing to be like, I would say this in this situation, but then like actually being in the situation, like it's not as easy as like I thought it was. So yeah, I feel like I learned a lot.
But this one was a lot more helpful, just because we got like feedback from our peers, and I thought it was really good because we were all taught the same things, and it was interesting to hear what they had to say about what we were saying.
I think that personally, like I only had one in-person psych simulation last semester, but I really like this a lot better because like a professor or a clinical instructor is here and our peers are here. And I think it's just like it's just helpful to have like that support and like piggyback off of other people's ideas. And like I feel like sometimes you can feel like lost or stuck in a conversation. At least I did last semester. But this like really just helped me a lot.
I don't feel like the aspect of it being virtual took away from anything. I feel like this was like really beneficial, and like especially to have like our instructor like right here to like stop us and be like, this is good, this is not good. And even just hearing like the different ways that like our peers would like word the questions, I thought that really helped a lot.
I don't know if anyone feels that, but whenever she says, well, we did well or not well or whatever, I'm like, no, that's not the point of debriefing. But again, it's the ability for them to really do that debriefing experience and learn from the patient and learn from their clinical instructor, because they're getting that real-time feedback in what they're doing, which again, it's so exciting to be able to see. And it's always great to be able to hear from our students that they really do enjoy these experiences with having a live interaction with a person. Again, a lot of times the institutions that we're working with, they don't currently have an SP program of their own. So it does provide a very unique experience of them being able to have a live person, get feedback, and then also being able to ask those questions of the patient of, if I would have said this, or if I could have done this, or how did you feel when I said this? Because again, they truly view the SP as the patient. Coming from the SP perspective, I can't tell you how many times I've been asked those questions of, you know, if I would have said this, or if I would have done this, how would that have made the patient feel? And again, I think that that's really important that they're being able to ask those questions, because they're not able to do so in a clinical setting. One of these experiences that we had, we practiced with attending physicians in a pediatric setting, and they had to tell a couple that their child had drowned. And again, they went through the entire simulation experience, and they were able to get feedback from, you know, the parents, the SPs, and the patient. And when they did that, the student was able to say, I've done this so many times, but I've never been able to look at the parents and say, how did I do? How was that? How, like, if I would have said this, how would that have made you feel? Or if I would have done that, you know, how would you have responded? Because it's not appropriate in a clinical setting. But that's what's so unique and so special about having those SPs, is that they are able to ask those questions of, you know, how would you have felt and what could I have done differently? And again, I think that that's super powerful to be able to put the patient at the center of those learning experiences, and really being allowing the SP or the patient to be able to speak for themselves and speak for how the patient felt during that experience. Because again, it's so important once they go to that clinical setting of knowing how the patient felt. So we're going to move on to Q&A. If you have any questions, please leave them in the chat. I'd love to answer them. And again, I just want to make sure that if you do have any further questions, we are going to be leaving a link in the chat box that if you fill out that form, we will be in contact with you and be able to answer any questions that you have, as well as doing a live demonstration for you. So again, we really want to make sure that if you have questions, it is a very unique way of doing simulation. So we want to make sure that if there are any further questions, we are answering those. So Kim, do we have any questions that I can answer?
Yeah, I think the best place to start is, what is the vetting process for the SPs that we use?
Yes, so all of our SPs that we use have been thoroughly trained through Avkin. So Avkin has a training process of what we do, which is on standardization, professionalism, and feedback. Those are our 3 key points. So every SP goes through that. We recruit them here locally just because we do have an abundance of SPs. Again, my network, just because I am an SP, is quite large of being able to find them. We make sure that they go through that training process. We make sure that they've done at least 10 hours of simulation experience. So you're not going to have a novice coming in who's never done it before. They will have experience with doing it. And then they're going to be trained on feedback. So again, we don't just send them in to give feedback untrained, they get feedback. And then I will be on the call those first 2 times. And again, I will give them coaching notes or anything along those lines if it's needed. So again, we have a very vigorous vetting process where they aren't just someone who is an actor, but they actually do have SP experience before coming in and being a part of any of the virtual SP opportunities.
So I think Erin kind of had a question about how the SPs provide feedback and the training we provide. And I think you answered that, Erin. If you need further expansion on that, please let me know. And then I think Adam has answered. Angelia asked, what is the rationale for potential customers to use Avkin to provide this versus building their own telesimulation program? And we have 11 years of experience with the SP modality and 9 months of experience in the virtual SP telesimulation format. Do you want to expand a little bit more on the Avkin model of build and create and train?
Yeah, I would love to touch on that, because we have seen a lot of people who have tried this on their own, of going out and recruiting SPs and then being able to convert this to a digital format. And a lot of times they run into a lot of roadblocks. And so then they come to us at a later date. And again, it sets them back of not being able to accomplish their simulations in the time frame that they want. So if you go out and you try to recruit SPs or get your own SPs and move it into a Zoom format, again, every opportunity that you can do that and be successful. But there are just nuances of being able to make sure that your SPs are vetted and make sure that your simulations are foolproof and ready for a live person. And then you have that whole digital component of if they're trained on Zoom. So again, all of our SPs have been thoroughly trained on Zoom, how to operate things, how to operate breakout rooms, turning on their camera, muting themselves appropriately. So again, there is a lot of the nuances that go into that. So you have every opportunity to do this, at your own institution with your simulations. It's just that you're going to have a little bit harder getting started. And again, we want to make sure that you feel well supported. So again, another opportunity that we do consulting that helps people start their own SP programs. And people are starting that a lot during COVID because they need these long-term solutions. And now what we're focusing a lot in our consulting is how to do it digitally, because again, that is a huge change. So even if you have your SPs, changing it to a telehealth, it does, you add in some wrenches there. So again, we have a thorough training solution of, kind of our standard of what we do, just because we have been doing it for so long. And we just want to make sure that you're able to have the most success out of your simulations and out of your SPs, and that those experiences are really rich. So we just make sure that all of those, I's are dotted, T's are crossed, and all of those things are in place, just because we've seen it with other institutions where they've tried to go out on their own and do it, but they don't really realize all of the different nuances that follow. So again, it's just that ability for us to really come in and guide you through that experience and guide you through all of the needed aspects of being able to have vetted SPs and then move it into a virtual setting, as well as having a detailed simulation that is ready for live people to interact with. And then also just on the feedback portion of that, I know we've touched on it, but it's very specific of how we do our feedback training, because again, we do not want our SPs to take over the debriefing session, nor do we want them to comment on the medical side of things. We really focus on that they are trained in a very specific cadence of how to give feedback strictly from the patient's perspective and how the patient felt during that experience. So that's really what we focus on. And again, it's very different than, just a traditional, generalized feedback.
And that feedback really focuses on learner safety. It's so important to have that SP giving that feedback from the patient perspective for the interest of learner safety. Another question we had was, do you have a recommendation for an actor that wants to become a virtual standardized patient, and what steps would they take?
Yeah, so I would highly recommend that if you want to move from being just an SP that does a lot of things live to being able to do things virtually, is connect with institutions, or again, send us your resume here at Avkin. Again, if you have experience in that, we're always looking for different SPs that we can utilize. But again, I would really encourage you to get familiar with Zoom. I think that that's a huge thing that a lot of SPs are not comfortable with using that technology or really the nuances behind it. And so often they just shy away from using it at all, and then they're not able to be utilized in those live or in those virtual experiences. So I would definitely encourage you to look into Zoom, get familiar with Zoom, and reach out to institutions or here at Avkin, because again, we're always looking for different SPs who have experience and can go through that training process. Any other questions, Kim?
I think that is answered. If you posted a question and we didn't completely answer it, please let me know. I think I've covered everybody that typed anything in. If there's anybody else that would like to have an answer to a question, we'd love to hear from you. I'm going to put that link back in the chat box again if you have missed it, and we'd be happy to set up a meeting with you if you have some further questions.
So again, if there is any further interest in starting your own SP program to start something virtual, or if you are interested in the Avkin SP solution, again, please reach out to us, click on that link, fill out that form, and we will have someone in contact with you to be able to do your own demonstration for your team to gain buy-in, but also just being able to do a thorough deep dive of what your needs are at your institution and the different potentials for the simulations. I wish we had more time and we could really go into the detail of these different simulation experiences, but these opportunities with these characters in these simulations, it's so rich and it's so valuable. And again, we really just want to make sure that whatever your institutional goals are, we can meet that with these simulations. And I'm really confident that we'd be able to do that to supplement some of your simulation hours with these live experiences. So Kim left that in the chat, so please feel free to click on that link and let us know. And if there's any last minute questions, I can stick around for a little bit just to answer those if there's anything that pops up, Kim.
And just to confirm, the recording will be available, as Olivia has posted in the chat also.
Stacy was asking about training for the SPs. Can this be done virtually or does it need to be in person? Megan, you want to talk a little bit about ASPE standards best practice and how you train SPs, especially in this current environment?
Yeah, so my main focus with training SPs is that I firmly believe you need to practice the way that you're going to run it. So if we're going to do a Zoom interaction, I'm going to do the training via Zoom because I want to make sure that they're well versed on that platform. Now, if it's a live experience, I want to make sure I do that training in a live setting and that they're able to see what that's going to be. But since these are going to be all virtual, we are able to do that virtual training. So like I was saying earlier, I can dive a little bit in because we have a little bit of time, but we really focus on standardization. And that's the key to utilizing live people, is that with the standardization that they are not playing, one's not playing it harder or easier depending on the group, and that they're not leading students during that simulation experience, but they are remaining the same and consistent all the way through. We then really focus on the feedback portion because again, there's a lot of nuances, and like Kim mentioned, learner safety. We really want to make sure that they are not going outside of best practice and telling them good and bad and things along those lines. We really want them to focus on strictly how the patient felt and being able to share that. So again, we really go through that very deeply. We also go through SP safety. So making sure that the learners are safe, but also the SPs are safe psychologically and emotionally. And then lastly, we go over professionalism, because the really nice part with this, anyone who does work with live people, you know that there's always that instance where they can not show up to sim or they're late or something happens. that's another huge cushion here at Avkin, is that you will never be left without an SP. You'll never be left with a late SP. We will always have someone there on time, ready to go and trained. Again, we have backups. We have people ready to go at all times for those simulation experiences. So anyone who knows working with live people, there is that element of, well, what if they don't show up? What if they're late? What if they're not prepared? But again, if you go through Avkin, you're going to be rest assured that you have someone who is ready to go at the correct time and is prepared on the simulation experience. So those are the main ways that we do our training and we do our vetting, and making sure that any SP that's going to be providing simulations for your institution has qualified at the Avkin level, and not just someone who wants to hop in and join. So again, we really make sure that we do a lot of emphasis on the training experience.
Erin had a follow-up to her question, so I'm going to unmute her so she can do some clarification here.
Can you hear me?
Yep, I can hear you.
Okay. Thanks for letting me come in and ask my question. I guess my question has to do with, in those big group debriefs, when you have an SP with all of your learners, if the SP has delta feedback for particular learners, I worry about the learner psychological safety in such a large group, and how you might handle some of those specifics in that large group.
Yeah, so again, the SP is very, is trained on, again, not providing any information that would be, you did this bad, or you did this poorly, or, whatever it may be. So again, it's very refined to how the patient felt. So that's always how they're providing the information, is just, this is how the patient felt when this happened. So again, it's very, I don't know how to put this, but just the consideration for learner safety is very high when we are training our SPs. And again, a lot of times they are able to identify some of those areas that they would have wanted to improve in, or what they would have wanted to work on. But again, the focus is really not that the SP is ever giving, you did this bad, or you needed to improve here, but really just sharing how the patient felt in those experiences. So again, a lot of times they are able to talk about that. That's something that we discuss in those training processes. But a lot of times it's something that can be that larger group discussion where they're able to share that. And again, the SP never just gives feedback and just leaves it at that, but it is an open conversation where they can ask questions of the SP and really engage in that learning opportunity, opposed to just, I'm sharing with you and you can receive this, but it really turns into that conversation where if the learner wants to discuss that, they're able to discuss that. So again, it's also supposed to be very about the experience that had happened, opposed to the specific learner and what they did correctly or incorrectly, or however you want to phrase that, but mostly focused on just how the patient felt in those interactions.
And that's just accomplished through that training. Thank you very much for answering my question.
Yeah, of course. All right, well, if we don't have any other questions, I just really want to thank you all for joining us. We're seeing that you guys are interested in future webinars. Again, that's something that Olivia is going to be sharing more information about future webinars. And we also can share some information about future Avkin webinars as well. So we can do both of those things. But thank you so much for your time and joining us. We really appreciate it. And again, if you're interested in more information, please click on that link, or contact us here at Avkin, and we'd be more than happy to walk you through everything. Thank you.